One-on-One with Regional One Health is your inside look at how we're building healthier tomorrows for our patients and our community. Join us for expert insight that empowers you to achieve a lifetime of better health. Today, certified nurse midwife Devin Johnson shares how midwifery can be a great option for women of all ages and stages of life. Welcome, Devin. It's great to have you here.
Thank you for having me. Good morning.
You know, when most people think about midwifery, I think the first thought is natural childbirth without pain medication. But actually, there is a bit more to what you do. So tell us really what your pregnant patients can expect for prenatal and labor and delivery in their experience with you.
Yes, I think the main three things people think of when they hear midwifery is pregnant people, home birth, and no pain medication. And none of those three automatically reply to certified nurse midwives. So we take care of well women throughout the lifespan, from menarche to menopause, so from first period to last period and beyond. We provide gynecological services, STI testing, contraception, as well as prenatal care. The midwives at Regional One, of course, deliver at Regional One inpatient on our labor and delivery unit, and we work with the same CRNAs and anesthesiologists that our OBGYN physicians work with to get our patients epidurals if desired. We can prescribe, so they can get IV medication prescribed by us if desired. So you don't have to be pregnant to see a midwife, you don't have to deliver at home to see a midwife, and you don't have to go without pain medication, even though we support both options.
So why would you go to see a certified nurse midwife versus another kind of birth or woman care specialist?
So midwives are experts in well women and normal pregnancy and low risk, low intervention deliveries. We absolutely need our OBGYN physicians. There are some patients who would have to see an OBGYN physician and would not be a good candidate for midwifery care. But for those patients that are good candidates for midwifery care, they get more personalized care. We generally have more time to spend with our patients. We know our patients a little better. We're less likely to employ interventions that aren't necessary. While they're the expert in certain complications, we're the experts in physiologic and normal healthy birth outcomes, even though they have very good healthy outcomes as well. We recognize complications when they occur, and we decide complications that we can manage versus complications that require either physician co-management or transfer to physician. So they're still getting safe, effective care under both circumstances. Midwifery care is more tailored to women of lower risk, women who want lower intervention, and who want more personalized support.
And then it sounds like your practice really puts an emphasis on building relationships with patients, especially because, as you say, you offer care from first period to last period. Does that help you provide better care and improve patients' health?
I feel like it absolutely does. I like to tell my patients that while we're the experts in healthcare, you're the experts on you. And the better we know them, the more comfortable we are, the more comfortable they are speaking with us, then the more detailed information we get, things that the patient may not realize is important, they're more likely to share. We may know like socioeconomic factors that can affect birth outcomes, barriers to getting access to care. We can tailor plans to their needs, their abilities. And so we see some of the same patients for annuals and for birth control that we've seen for prenatal care and on labor and delivery and postpartum. Some of those patients have brought their family or their children to us. And so that just that knowing the whole patient, not just their health history sometimes, but their socioeconomic history, helps us tailor their care to them and helps them feel safe and feel comfortable sharing things that sometimes patients are tempted to withhold if they feel uncomfortable.
So yeah, I can see where that would really improve the whole health care experience and get you more information too when something isn't right. How long have you been practicing, and do you have patients that you're growing old with?
Oh, growing old. So I've been a midwife for a little over 10 years. I've been with Regional One for right at 7. So I have patients that I have seen when they were like a teenager and now they're having their first child, or we've had numerous patients come to us for multiple pregnancies. I actually think of one patient in particular that came to us for multiple pregnancies, and then her oldest daughter came to us, actually a couple patients under those circumstances. And then sometimes I run into them when they're with a family member who's coming to see us, and they're like, oh, look at this baby you delivered, and they're now 5, and it's like unbelievable that it seems like just yesterday I was seeing you and I was at your delivery, and now it's your little sister or your cousin that you're bringing to us for care, and you're updating us on how your life is going, or you're coming back to us just for birth control
Oh,
or for a
wow.
well woman.
Yeah, I mean, mothers bringing their daughters to you for their first, like you said, from first period to last. It's amazing the comprehensive care you give. That's why I asked if you were aging along with anyone, because in your practice, like you said, you're going to keep coming around to some of the same people. It just sounds so much like certified nurse midwives can provide such personalized care for all stages of life.
That is definitely our goal, to make you feel heard and seen. We want our patients to be partners in their care.
Well, thank you, Devin, for this detailed overview on the midwifery services at Regional One Health. Appreciate it.
Thank you for having me.
Regional One Health's certified nurse midwives see patients in 2 locations. For Kirby Primary Care, call 901-515-5350. And for Hollywood Primary Care, call 901-545-6969. You can also learn more at www.regionalonehealth.org/midwifery. Thanks for making one-on-one with Regional One Health part of your journey to better health. Join us next time as we cover another topic to keep you on the path to a healthier tomorrow. Until then, be well.